This conference will now be recorded.
Hello, my name is LaDonna Cavanis, and I am an instructor here at Ultimate Medical Academy. And today we're going to be reviewing the cardiovascular system. So let's get started. So, related combining forms. So, let's talk about the structures of the heart. Okay, so we're looking at the heart, the blood vessels, the arteries, the capillaries, the veins, and the blood. Related combining forms for the heart are CARDO and CARDIO. Related combining forms for the blood vessels is ANGIO and VASO. Related combining forms for the arteries are ARTERIO. To the capillaries, CAPILLO. Related combining forms for the veins is PHLEBO and VENO. And related combining forms for the blood is HEMO and HEMATO. So the cardiovascular system consists of the blood vessels, the heart, and the blood. When you break cardiovascular down, CRDIO means heart, vascular, VASCUL, blood vessels, and AR is always pertaining to. Functions of the cardiovascular system. It's liquid tissue, it transports oxygen and nutrient, it returns waste products, it carries carbon dioxide, and it's important in immune and endocrine system. All right, so heart, again, let's break that down. CARDO and CARDIO. Muscular organ, it furnishes power to maintain blood flow. The pericardium is a membranous sac enclosing the heart. And let's break that down. PERI refers to surrounding, and CARDI refers to the heart, and UM is singular noun ending. The walls of the heart consist of the epicardium, it's the exterior layer, the myocardium, which is the muscular middle layer, and the endocardium, which is the inner layer. And here's a image of the walls of the heart. Same here. Blood supply to the myocardium. Coronary arteries supply oxygen-rich blood. Coronary veins remove waste products from the myocardium. Chambers of the heart consist of the atria. It's all blood enters heart through these two upper chambers. The ventriculars, two lower chambers that pump blood throughout the entire body. Valves of the heart, and we're going to discuss that coming up. So let's start with the tricuspid valve. It controls openings between right atrium and the right ventricle. It has three cusp points. Pulmonary similar valve. It's between right ventricular and the pulmonary artery. Pulmonary is pertaining to the lungs. The mitral valve. It's between the left atrium and the left ventricle. It has two cusps. Aortic similar valve between the left and right ventricle and the aorta. Systematic and pulmonary circulation. Pulmonary circulation, flow of blood between the heart and the lungs. Systematic circulation is flow of blood to all parts of the body except for the lungs. And here's an image of the systemic and pulmonary circulation, how that works. Heartbeat. Pumping of blood throughout the body by contraction and relaxation of the heart. The rate and regularity determined by electrical impulses of the myocardium. Conduction system of the heart, the sinoarterial node, and posterior wall of the right atrium, the heart's natural pacemaker. Atrioventricular node on the floor of the right atrium, and the bundle of his within the intraventricular septum. And this is the conduction system of the heart. All right, the pungent fibers within the walls of the ventricular. Stimulation causes ventricular to contract. Conduction system visualized as wave movements on an EKG or ECG. All right, here's another image of the heart, the heartbeat. The blood vessels. The arteries carry blood away from the heart. The aorta is the largest artery in the body. The arterioles, small arteries, carry blood to the capillaries. Capillaries deliver oxygen nutrients to the cells. Venules, the smallest veins, join from larger veins, and the veins carry blood toward the heart. Valves to prevent blood flow of backflow of blood. Pulse and blood pressure. Rhythmic pressure against the walls of an artery caused by contraction of the heart. Blood pressure is the amount of systolic and diastolic pressure extended against the walls of the arteries. Systolic pressure, ventriculars contract, whereas diastolic pressure, ventricles relax. Blood is composed of plasma and formed elements. Plasma contains nutrients, hormones, waste, serum, plasma minus the clotting factor, fibrogen clotting proteins in plasma. Formed elements. Erythrocytes, and let's break that down. ERYTHRO refers or means red, and cytes, CYTES, means cells. Mature red blood cells produced by red bone marrow transport oxygen to the tissues. Hemoglobin, hemo means blood, globin means protein. Is oxygen carrying blood protein pigment. Formed elements. Leukocytes. Leukocytes means white. Well, leuko means white, okay? So here we're talking about white blood cells. Defend body against infective organisms and foreign substances. Neutrophils, the immune system defense. Basophilus cause symptoms of allergies. Eosinophilus destroys parasites and organisms. Lymphocytes produce antibodies, and monocytes immunoglobulin defense. Formed elements. Thrombocytes. Let's break that down. THROMBO means clot. It's the smallest formed element, and it's an important role in the blood clotting factor. And here's just a breakdown of the blood. So let's talk a little bit about that. Blood types. They're classified according to the presence or absence of certain antigens, listed as A, B, AB, O, followed by the Rh factor. Rh defines the presence or absence of Rh antigens on red blood cells. Rh antigens present in Rh positive, Rh antigens absent in Rh negative. Blood gases. Gases normally dissolved in plasma. Major blood gases: oxygen, carbon dioxide, and nitrogen. Let's talk about medical specialists related to the cardiovascular system. Cardiologist, cardi means heart, ologist is always referred to as specialist. Diagnoses and treats abnormalities of the heart. I myself have hypertension, so I have to um, see my cardiologist annually for stress tests and to go over my blood pressure medications. Hematologist, hemat refers or means blood, and again, ologist, specialist. Diagnose and treat abnormalities of the blood. Vascular surgeon diagnose and treats disorders of the blood vessels. Pathology of the cardiovascular system. Congenital heart defects, abnormalities present at birth, may be apparent at birth, may not be detected until later in life. So again, um, a congenital heart defects, um, sometimes it may be apparent at birth, and then sometimes, excuse me, it may not be noticed until later in life that the child has some type of issue with the heart. Coronary artery disease, CAD, it's the most common type of heart disease. Arteriosclerosis of the coronary arteries causes insufficient supply of oxygen, may cause angina, myocardial infarction, or death. Arteriosclerosis. Arterial means plaque or fatty substance. Sclerosis is abnormal hardening. Hardening and narrowing of the arteries caused by buildup of plaque or on the inferior walls of the arteries. Ischemia. ISCH, to hold back. Emia means blood. It's due to restricted blood flow caused insufficient supply of oxygen to the tissue. Angina, inadequate blood flow to the myocardium. Resulting chest pain may worsen due to continued restricted blood flow, may lead to myocardium infarction. Myocardium, a cardio infarction, excuse me, it's an occlusion of one or more coronary arteries due to plaque buildup. Damage to the myocardium impairs heart's ability to pump blood throughout the body. Frequent symptoms consist of pain or pressure in the middle of the chest that may spread to the back jaw or left arm. May be asymptomatic. So when we talk about asymptomatic, that means not showing any signs and symptoms. So what they're saying here is that there may be symptoms and there may not be symptoms when it comes to a myocardial infarction, which is a heart attack. Heart failure. It's a chronic condition. Heart is unable to discharge all the blood it receives, resulting in congestion. May be left-sided or right-sided. It may result in cardiomegaly, which is enlargement of the heart, abnormal enlargement of the heart due to increased pumping ability, and it's very common in elderly. Carditis, inflammation of the heart. CRD means heart, and itis again is inflammation. Endocarditis, endo is within. Inflammation of the inner wall lining of the heart. Pericarditis, peri means surrounding. Inflammation of the pericardium. Myocarditis, myo means muscle. Inflammation of the myocardium. Diseases of the myocardium. Cardiomyopathy. Cardio means heart, myo means muscle, and pathy means disease. Term to describe all diseases of the heart muscle. Heart valves. Heart murmur, often caused by defective heart valves, usually does not require surgery unless a patient's quality of life is affected. The valvitis, valvular valve is valvular refers to valve, and itis refers to inflammation. So inflammation of the heart valves. Valvular prolapse. And again, it's an example of VALVUL, which means valve, and prolapse means dropping down. It's abnormal protrusion of the heart valve. Valve cannot close completely. Valvular stenosis, abnormal narrowing of the opening of the heart, narrowing and stiffening of the heart valves. Excuse me. Cardiac arrest and arrhythmia, loss of normal rhythm of heartbeat. Astole, A is without, and systole is contraction. Complete absence of electrical activity in the heart. Cardiac arrest, heart abruptly stops beating. Cardiac arrest and arrhythmia continues. Sudden cardiac death occurs when treatment of cardiac arrest is not provided quickly. Heart block, congenital or acquired arrhythmia. Electrical signal unable to reach ventricles. Bradycardia, its heart rate below 60 beats a minute. Brady means slow, card means heart, IA is abnormal condition. Tachycardia is heart rate above 100 beats a minute. Tachy means rapid. Supraventricular tachycardia. It's rapid, regular heartbeats originating at or above the AV node. Ventricular tachycardia is rapid heartbeats beginning within the ventricles, may be fatal. Fibrillation, it's potentially life-threatening, fast, irregular heartbeats. Atrial fibrillation, contractions of atria becomes rapid and uncontrolled. Ventricular fibrillation, rapid, irregular contractions of ventricles may cause sudden death. Palpitations, pounding, racing heartbeats, may be regular or irregular, may be due to heart disorder, or may occur during a panic attack. Acromion, extension of scapula. It forms high points of the shoulder. Blood vessel abnormalities. Vasculitis is inflammation of the blood vessels. Vascular means blood. Vessels refers to vascular refers to blood vessels, and itis refers to inflammation. Polyarteritis involves several medium and small arteries. Temporal arteriitis. Symptoms are headaches, visual impairment, and jaw pain. Angiostenosis, abnormal narrowing of the blood vessels. Angio refers to the vessels, and stenosis refers to abnormal narrowing. Hemangioma, benign tumor composed of newly formed blood vessels. Hem means blood, angi, blood or lymph vessels, omia means tumor. Hyperfusion, it's deficiency of blood passing through an organ of the body. Aneurysm, localized weak area or enlargement of the wall of the artery. Arteriosclerosis, arterial means artery, sclerosis, abnormal hardening, loss of elasticity of the atrial walls. Arteriostenosis, arterial refers to artery, stenosis abnormal narrowing of the artery or arteries. Veins, chronic venous insufficiency, partial vein blockage causing inadequate venous circulation. Phlebitis is inflammation of the vein. Varicose veins, abnormally swollen veins due to improper function of valves. Thrombosis and embolisms. Thrombosis, Throb, means clot. Osis refers to abnormal condition or disease. Having a thrombose. Thromb, means clot. US singular noun ending. Blood clots attached to the inferior wall of vessels. Thrombotic occlusion. It's blocking of an artery by a thrombus. Coronary thrombosis. CORON, crown. ARY means pertaining to. OIS is abnormal condition. Damage to heart muscles due to thrombus blocking a coronary artery. Deep vein thrombosis. Thrombus attached to the inferior wall of the deep veins. Embolism. EMBOL, something inserted. ISM refers to condition. Sudden blockage of blood vessels by embolism. Embolus, foreign object circulating in the body, may be blood clot, quantity of air or gas, or piece of tissue or tumor. PVD, peripheral vascular disease, disorders of the blood vessels located outside of the heart or brain. Peripheral artery disease, impaired occlusion caused by arteriosclerosis. Raynaud's disease, peripheral occlusion disease triggered by cold or stress. Blood disorders. Blood dyscrasia, any pathogenic condition of a cellular element. Dys means bad. Crasia, a mixture or blending. Hemochromatosis. HEMO means blood. CHROMATE is color, and osis is abnormal condition or disease. Genetic. Intestines absorb too much iron, causing its accumulation in the organs. Leukopenia. LEUKO means white, and penia means deficiency. Decrease in number of disease-fighting white blood cells. Polycythemia is excess production of red blood cells by bone marrow. Sepsis is infection in the bloodstream. Thrombocytopenia. Thrombo means clot, cyto means cell, and penia refers to the deficiency. Abnormal small number of circulating platelets, often associated with abnormal bleeding. Thrombocytosis. Thrombo means clot, cyte, cell, osis, abnormal condition, and it's an abnormal increase in circulating platelets. Hemorrhage. Hemo means blood, and rich is bleeding, loss of large amount of blood. Transfusion reaction, complication of blood transfusion, occurrence of severe immune response due to infusion of incompatible blood, may be fatal. Cholesterol, fatty substance traveling through the blood. Hypolipidemia, hyper, excessive, lipid, fat, emia, blood condition, general term for elevated level of cholesterol. Excuse me. Leukemia, MYELODY, dysplastic disease, cancer due to insufficient production of one or more types of blood cells, may progress to acute myeloid leukemia. Leukemia. Leuc means white, emia, blood condition. It's a cancer characterized by progressive number of abnormal leukocytes in the tissue, organs, and blood. Type is based on rate of progression and type of white blood cells involved. And this is myelodysplastic disease. Anemia. AN without or less than, emia, blood condition. Decreased number of erythrocytes. Aplastic anemia. A means without, plast, growth, and IC pertaining to. Absence of all formed blood elements. Iron deficiency anemia due to insufficient amounts of iron. Okay, blood disorders continues. Megaloblastic anemia. Megalo refers or means large, blast, immature, and IC pertaining to larger than normal red blood cells. Pernicious anemia. It's due to body's inability to absorb vitamin B12. Hemolytic anemia. Hemo means related to the blood, and lytic refers to destroy. Inadequate number of circulating red blood cells. Premature destruction of red blood cells by the spleen. Sickle cell anemia. It's genetic abnormal hemoglobin resulting in some red blood cells assuming sickle shape. Thalassemia. It's inherited. It's due to reduced hemoglobin and fewer red blood cells than normal. Okay. Hypertension is elevation of atrial blood pressure, may cause damage to the cardiovascular system. Types are essential, secondary, and malignant. Hypotension is lower than normal atrial blood pressure. Orthostatic hypotension occurs upon standing. Diagnostic procedures of the cardiovascular system. Angiogram. Angio refers to the blood vessels. Graphy, it's the process of recording. Radiographic study of blood vessels after injecting a contrast medium. Cardiac catheterization. Catheter is passed into a vein or artery and guided into the heart. Digital subtraction angiography. Subtracting of soft tissue and bones from images with computer assistance. Duplex ultrasound. It's a diagnostic procedure to image vessels and blood flow. Venography. It's viewing of specific veins after injecting dye. Electrocardiography. Electro means electro refers to electric, and cardio refers to the heart. Non-invasive recording of the electrical activity of the myocardium. Electromyocardiogram, EKG or ECG. And gram means picture or record. Record of electrical activity of the myocardium. Holter monitor, portable EKG worn by ambulatory patient. Monitors heart rhythm and rate for 24 to 48 hours. A stress test, monitoring with EKG while patient exercises on a treadmill or is injected with a chemical to increase the heart rate. Thallium stress test, injecting thallium and assuming blood flow through coronary arteries during exercise. Nutritional interventions, restrict sodium intake, decrease intake of fast foods or processed foods, and limit cholesterol intake, foods derived from animals. Cardiac surgery, cardiopulmonary bypass, CPB. It's also known as a heart-lung machine. Angioplasty. Angio means blood vessel. Plasty, surgical repair. Mechanically widening of the obstructive vessel. That's what the angioplasty does. Percutaneous transluminal coronary angioplasty flattens plaque and stretches lumen of the vessel. Laser angioplasty. It removes plaque using beams of light. A stent. It's a wire mesh tube supporting atrial wall. Arthrectomy. ATHER means plaque, and ectomy is surgical surgical removal of plaque. Carotid endarterectomy is removal of the portion of the clogged carotid or artery. Coronary artery bypass. Portion of the vein from the leg or chest is implanted. It replaces blocked coronary artery, and it improves blood flow to the heart. Excuse me. Defibrillation. It's an electrical shock to restore normal rhythm. It's automated external defibrillator, AED, automatically samples rhythm and externally shocks the heart if needed. Designed for use by non-professionals. Artificial pacemaker, electronic device that regulates the heartbeat. Treatment of cardiac arrest and arrhythmias. Implantable cardiodefibrillator regulates heartbeats, defibrillates if disruption of the heart rhythm occurs. Cardiac ablation scars or destroys the heart tissue that is triggering an abnormal heartbeat. It uses radio frequency energy or cryoablation. Valvuloplasty. VALVUO means valve, and plasty refers to surgical repair. Surgical repair of the heart valve, valvuloplasty. Heart valve replacement. Replacement of a heart valve, usually aortic or mitral. Transcatheter aortic valve replacement. Collapsible replaceable valve expands to resume function of a defective valve. Cardiopulmonary bypass resuscitation, CPR. Artificial respiration and manual external cardiac compression. Compression only resuscitation. Manual external cardiac compression only. Aneurysmectomy. Aneurysm refers to aneurysm, and ectomy means surgical removal. Surgical removal of aneurysm. Aneurysmography. RRHAPHY, surgical suturing. Surgical suturing of an aneurysm. Aneurysm clipping is placement of a clip at the neck of an aneurysm. Arteriectomy, ARTERI, ARTERY. Ectomy is surgical removal. surgical removal of a part of the artery. Homeostasis. HEMO means blood, stasis stopping or controlling. Stopping or controlling bleeding. Plasmapheresis means removal of blood and separation of cellular elements. All right, that concludes my presentation. Again, thank you for joining me.